My name is Rocio. I'm a family nurse practitioner student. Today is Friday, August 23rd, and I'm going to perform the 360 inspection of the room. Okay, this is the end of the inspection of the room. And I'm going to place the camera here. Okay, so I'm going to ask for consent to my patient. So do you consent for me to perform an abdominal exam? Yes. Okay, thank you so much. You can lay on your back. Cover you up. And then if you can please cover your abdomen, and then you're gonna put it below your breast. Okay, thank you. So before I have any physical contact with my patient, I'm going to perform hygiene, wash my hands, and I'm going to start with inspection. So I see her abdomen, and she has a flat contour, and I don't see any presence of any mass, scar, or tenderness. And I see that her skin appearance is normal, and it is according to her ethnicity. So after the inspection, I'm going to start with auscultation. I'm going to listen into the vowel sounds in the 4 quadrants. So I'm going to start with the right upper quadrant, left upper quadrant, right lower quadrant, and then left lower quadrant. Okay, so her vowel sounds are normal active and between 5 to 34 per minute. Now I'm going to also listen and look for the aorta artery, and this is located in the above of the umbilicus. And then I'm going to proceed with the renal arteries, the right renal artery. Listen to that. Left renal artery. And then I'm using my diaphragm on the iliac artery on the right side. Left artery. Right and left. And then the femoral artery. Right, left. There's another. Right and left. Okay, so I see there's no presence. I heard there is no presence for any bruit. And now I'm going to proceed and do percussion. I'm going to percuss the 4 quadrants. I'm going to start with the right upper quadrant, left upper quadrant, right lower quadrant, and then left lower quadrant. So there's a tympanic sound in all quadrants, and this is a normal finding. If I find a dullness sound, this means that the patient may be accumulating some fluid space. Now I'm going to percuss and look for the liver. And it starts with the umbilicals on the right side, like the right upper side. Okay, so there was tympanic, and once I heard the dual sign, this is my mark here, I stop here, and then I'm gonna come from the mid clavicular. Okay, this is okay, tympanic, this is dual sign, and then I see my margins here. So the measurement of the liver it is 6 to 12 centimeters, and this is a normal finding. Now I'm going to percuss the spleen, and this is on the left axillary, anterior axillary. Okay, so I heard that's a tympanic sound, and this is normal. So now I'm going to perform the light palpation. And this is for my patient to get familiar with my palpation. So the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. Okay. So any pain with this? Okay, that's good. This is expected. Patient should not have any pain. And now I'm going to proceed and do my depalpation on the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. Okay, any pain with this? Okay, and this is also expected. Patients do not have any complaint. I don't see any tenderness, and I'm going to start with the special testing, and the first one would be having my patient put get one of your hands in the middle of your abdomen. There you go. So I'm gonna perform the wave test, and this is to find any ascites on patient. So once she has her hand in the middle of her abdomen, I'm going to tap one of the side of the abdomen. Okay, so this is negative, and because I didn't see any wave on the moving on the left side, I'm sorry, on the right side, so this is negative. So if I would have seen a wave moving on the other side of the abdomen, this will be a positive sign of ascites. Okay, thank you so much. And then I'm going to perform the Murphy sign. So this is to inspect the gallbladder and see if the patient has any cholecystitis. So I'm going to do deep palpation on the right upper quadrant. So you're going to take a deep breath. Okay. Exhale. And then I'm going to do the deep palpation. And then if my patient complains for pain once it exhales and on my deep palpations, this will be a positive sign for cholecystitis. Now I'm going to perform the McBurney sign, and this is to see if the patient is experiencing any appendicitis. So I will be locating the iliac side, and then the umbilicus, and then just right in the middle or between these two, I will perform deep palpation. Take the breath, deep breath, and then exhale. Okay. So if the patient complains for pain on deep palpation, this will be a positive McBurney sign. So now I'm going to have you sitting up, and I'm going to perform the CVA tenderness, and then if you can put your back a little bit facing the camera. So this CVA tenderness test is to see if the patient is having some renal problems, for example, for pyelonephritis. So I'm going to do an indirect technique and direct technique. So this is my indirect technique on both sides. Any pain? Okay, and this is direct technique. Any pain? Okay, so if the patient experiences any pain of my with my technique, this will be positive for any pyelonephritis. Okay, so this will be the end of this examination. Do you have any questions? No? Okay, well, I thank you very much for allowing me to perform your test. Thank you.